Hello, this is Alyssa Cummings again, continuing my Module 6 health assessment. We're just going to finish up with the ankles and then we'll move on to neuro. I am sorry about that, my computer kind of cut out. So as I was saying before, let me just tilt the computer down. Basically, we look at the ankles and the feet for any deformities, or tenderness, pain, swelling, which I don't see any here. And then you also palpate the back of the ankle, the Achilles tendon, for pain and tenderness as well, which our client has already said that she doesn't have. After that, basically what we're going to do is we're going to do plantar flexion. Yep. So, and then plantar extension. Yep. So this is flexion. This is extension. And then we're going to do inversion and exversion. Perfect. So that's showing that she has full range of motion of her ankle. And then, like we did with the hips and the shoulders and the elbows, we're also going to check strength. So I'm going to push down your foot, and you're going to push up on me. Perfect. And push down. Perfect. And she has +5 for strength in her feet. Thank you. Finally, finishing up musculoskeletal system, we're just going to show you the 2 different ways to test for carpal tunnel. So using our client here, what we're going to do is we're going to have her take her hands and put them inward like this. And basically what this is testing is after 60 seconds, if she has numbness and tingling in her fingers, that's a positive sign and more assessment needs to be made for carpal tunnel. The other one is by testing the median nerve, which is right down here. You take 2 fingers and you just tap. If she has numbness and tingling in her fingers, that also proves that she has carpal tunnel. You want both of those things to be negative. Up next in our assessment, we're going to do the neuro. So when first walking in and meeting a client, you can test their whether or not they're alert and oriented just by saying hello, asking them what their name is, what the date is, what they came to the doctors for, the whole 9 yards. We can also do a mini mental status tool in order to find out if the patient is alert and oriented. One of the things that we can do in order to test the olfactory nerve is first what we're going to have the client do is we're going to have her take her finger and put her finger over one of her nostrils and just blow for me. We want to make sure that the nostril is patent. Next, what we're going to have her do is she's already closing her eyes, but you would have the patient close her eyes and smell a smell.
It smells like peppermint.
It is peppermint. So, and that's how you would check the olfactory nerve. With her eyes closed, that says that her nerve is intact and she was able to get the smell correctly. Next, we don't have a Snellen chart in order to, test the optic nerve, but you would take a Snellen chart, and by doing so, you would cover one eye, and then rotate and cover the other eye, and you want to test both the right, the left, and then test them together to see which eye is stronger and which eye is weaker, or if they're both equal. And you would also want to check their acuity, farsightedness, and nearsightedness. And actually, one thing that we can do is, in order to check, Brielle's optic nerve here today, is we can give her a piece of paper and ask her to read the top sentence on the paper.
So Module 6 health assessment.
Awesome, and that's exactly what it says. Next, what we're going to do is we're going to test her peripheral vision. Basically what I'm going to have her do is I'm going to have her cover one eye, and you would do this bilaterally, but for the sake of time I'm going to have her cover one eye, and we're going to come in from behind. And what I'm going to have her do is I'm going to have her tell me when she can see my fingers. So go ahead and tell me when you can see my fingers.
I see him. I see him. I see him.
Awesome. So she was able to see the movement of my fingers both through all 4 of the quadrants. The next optical nerves that we can test are 3, 5, and 6, and you can actually test them together with a light source. Unfortunately, I left my pen light at home, but I'll just go through it quickly. So using a light source, you can test PERLA, which is pupils are equal, round, reactive, and accommodate to light. Accommodation is actually something you can do without a light source. So for instance, what we're going to do is I'm going to just have the patient follow my finger. There we go. So the patient accommodates fine. And another thing that we can do in order to check the muscles of the eyes is I'm going to have the client follow my finger again, and I'm going to make a letter in the just in the air. And basically what you're looking for is to make sure that tracking is parallel and no nystagmus. So I did an H in the air, and I did see no tracking and no nystagmus. Next, what we would do, but we're not going to do it today, is in order to check the temporal and the masculine parts of the face, I would take like a paper clip, and I would, on the patient's skin, I would do the sharp side and then do the dull side, so she knew what was different, like the different feeling. And then I would go all across her face and have her close her eyes and tell me what she felt, sharp or dull. So that's called the sharp and dull tool. Moving on to cranial nerve 7, basically what we're looking at is just the facial expressions. So we're going to have our client raise her eyebrows for us, and as you can see, they raise symmetrically. We're going to have her close her eyes tight and smile. There you go. So symmetrical facial expressions. Next, for cranial nerve 8, which we've done in another video, we would have the client occlude one ear. We would say 3 words and have the patient tell us what the 3 words were. And then we would also do the Rhine in the Weber test. Like I said before, I previously explained this in another video. And then cranial nerves 9, 10, and 12 can actually be done together as well. So what we have the patient do is we have them stick out their tongue. And as you can see, is she has, well, you can't see, she has symmetrical rise up the soft palate and a positive gag reflex, and I would test this using a tongue depressor and by just touching the soft palate. And then we would also look at the sides of the tongue and make sure that there's symmetrical, midline, and no deviation. And cranial nerve 11 is the spinal accessory nerve, which we tested during the musculoskeletal part of this video. So the final part of this video is we've already tested for strength and coordination, but basically in order to move things along, I would have our client stand up and walk heel to toe for us in order to show that she has good coordination. I would test her deep tendon reflexes with a reflex hammer. And I would also do sensation, not just on her face, but on her whole body to make sure that sensation can be felt all over with the dull and the sharp side of a paper clip. And then we would also do palmar drift. So basically I would have the patient close her eyes, put her palms straight out, and if one of her palms dropped, this would be an indication for stroke. So basically you just want both of them out straight in front of you. And then finally is coordination. So what you would have your patient do is you would have them touch all their fingers to their thumb, see if they can go faster, and if they can't, that's okay. Some people can't. Or you would have them flip their hands up and down on their legs. Thank you so much.